Actually, pareho lang, no? So, I'm looking at the data of teenage. Ang problema natin sa childhood pregnancy ang tawag ko, I don't wanna call it teenage pregnancy because I have a problem between the 10 to 16 years old. Kasi that's actually technically statutory rape. So, I'm planning to probably make that reportable. And then we're also addressing yung up to 18 because in the WHO, anyone below the age of 19 is considered a child. So if you get pregnant below 19, that's a child pregnancy. I refuse to use the term teenage pregnancy because it sounds tolerant. So I'm not tolerant. So we have big problems with teenage pregnancy. Number one, yan ang nagko-contribute sa maternal mortality kasi hindi sila nagpapa-prenatal. Sila ang high risk for what we call eclampsia and preeclampsia and hemorrhage at childbirth. So kung ma-control natin yan, we will actually be able to decrease maternal mortality, yung mga sinabi sa speeches. And of course, yung family planning methods.
Is it alarming?
Yes, yes. We have a very high incidence of family planning. Okay, itong na ang figure for our 15 years old, under 15, it's 59 per 100,000. Dapat yan zero. 15 is a child, di ba? Dapat yan zero. Last year's data. Yes, I've actually met with Secretary Sani Angara. Ito ang isa sa unang pinag-usapan namin, yung how to be able to help stop the rise in may kakabit din tong childhood pregnancy yung ang ating HIV among children because we're getting HIV cases at 15 years old.
So, ano po yung challenges in terms naman of implementing responsible parenthood family planning programs?
So, number one is of course literacy, no? And education. So, andyan yung mga minention ng President sa speech niya, yung education, family planning, education, responsible parenthood, education and seminars. Tapos the second is really commodities, making the commodities for family planning, modern methods of family planning available. And of course, there's also religious, kasi some have religious or personal background na ayaw nila gumamit ng any form of family planning. Or kung gagamit, yung natural lang, di ba? So, that contributes to high numbers of children.
Secretary, having said that, nagkaroon ba kayo ng adjustment po sa pag-iigir po ng mga
Well, pinaiigting namin yun, our population growth rate is actually decreasing. It's actually in what we call a demographic sweet spot. We cannot hold that very long kasi after a while, mag-age naman tayo, the aging population. So we've moved down, our fertility rate went down from 2.1 in 2019. Now it's only it went down to 1.9 the year after COVID 2022. And then today the latest figure is 1.7. So we're hoping that keeps steady. That means kumukonti na rin ang population. Although if you look at the segments ng population, yung poorest still have about 2 or 3 kids up to 4 sa lower socioeconomic class. So there's still work to do. Hindi tayo pwedeng huminto.
Sec, yung childhood pregnancy po ba, yun yung nag-a-account sa most ng cases ng unwanted, ng mga unwanted pregnancy, yung childhood pregnancy?
Oh, every childhood pregnancy is an unplanned pregnancy. So I don't know if they want it or not, but it's considered in our terminology, we call it unplanned pregnancies. And in responsible parenthood, you want only planned pregnancies.
So, nabanggit ko kanina na medyo alarming yung pagtaas ng kaso ng pregnancy. So, ano nga yung bakit
Okay, number one, our children are already exposed to the internet. So what we've discovered is yung internet has a big influence on sexual behavior of our teens. And then there's peer pressure. Of course, madami na rin tansin ganun. Then the socioeconomic classes. Many in the lower socioeconomic class, ang gusto ng iba makapag-asawa, makatakas sa poverty ng kanilang family. So yan, social factors, cultural factors, internet, education talaga. And all of this combined actually add to the increasing rise of childhood pregnancies.
Secretary, for the record, ano yung challenges ng childhood pregnancy for the mother and the baby?
It has the highest risk, no? usually ang binabantay namin yung primi-gravid or the first pregnancy na bata. Kasi when they're young, the complications for tinatawag na eclampsia. Eclampsia is hypertension in pregnancy, tapos yung mga medical conditions that lead to hemorrhage. So kaya we need to watch them closer. And ang problema, sila yung hindi nagpapatingin. They hide the pregnancy and they will just end up in the hospital when they are already in labor. So they don't get the micronutrients, they don't get the follow-up, the ultrasound check, wala. So ang daming kailangan gawin.
Sir, kung decide on PH, paano na rin natin
So, continuous tayo dyan sa family planning and development programs. In-incorporate ko siya dun sa aming programa ng bukas, bagong urgent care and ambulatory services center. Sabi ko, make it available, all the family planning sessions. And then we're going around in the Purok Kalusugan program, primary healthcare, looking at pregnant mothers and people that would want modern methods of contraception. Thank you very much. Maraming salamat.
Sabi.
Pa-message lang, gusto nila akong bigyan ng ano. Panalo ang pamilyang planado. Panalo ang pamilyang planado.